One of our local experts shows us a way some families are learning to release the stress, relieve tension, and calm their emotions.
It's a technique first used to help war veterans. Our Sandra Ali explains how TRE is helping adults and children.
It's called TRE, which stands for tension or trauma releasing exercises. Families are learning the method in one session to help them deal with the effects of this past year.
Rochelle Robinson admits for the last year and a half, she noticed herself becoming increasingly more stressed. Even after trying out several ways to get a handle on it, Rochelle felt she was losing her way emotionally.
I decided that we would, do some healing or try some other modalities.
She never stopped going to work, but yet still felt overwhelmed with so much uncertainty. During the pandemic, Rochelle and her 11-year-old daughter, Carrington, looked into taking TRE sessions with Dr. Rose Moten as a possible solution.
It's a revolutionary way to feel better. It actually helps us to reconnect with our innate ability to discharge the negative effects that prolonged stress, trauma, worry, all of that stuff has on us emotionally and physically.
And they're glad they did.
It's one session, believe it or not. In under 90 minutes, a person can learn this tool that they'll have for the rest of their life. And they can engage in this tool at any time.
Dr. Rose says in that one session, patients learn a series of 7 exercises designed to fatigue your muscles, to shake off stress, and make you not as resistant to stop shaking when you do them on your own.
I've had individuals who actually suffered from COVID coming in after they've recovered from COVID to get this training to help them because of the stress and trauma, both emotionally and physically, they experience from even contracting the disorder. But for any of us, even those of us who may not have been on the front lines, or those of us who, did not contract the virus, we were impacted. Veterans Administration considers this a treatment modality for combat veterans, re-entering society to help them discharge, the trauma that they've experienced has had on themselves. This is being used 35 countries around the world, especially in countries that don't have access to mental health services. This is needed now more than ever. We had a lot of folks just coming in prior to the pandemic, pre-pandemic, because they recognized they needed it in their lives. And you just think globally what we've gone through. Individuals now are calling and they're coming in and they're making these sessions to come in because they recognize the effect that this pandemic has had on both them individually as well as the family.
Just like Carrington, Dr. Rose sees this as an excellent way for children to learn how to regulate their emotions.
And this TRE helps individuals, both children and adults, to learn to better emotionally regulate, to self-regulate their emotions. So we have people that come in and report better relationships, the ability to not be so triggered and be so reactive when stress happens. And these are beautiful things.